On today's World Insight, millions more COVID cases worldwide, no thanks to an Omicron-fueled surge. What's the long-term prognosis? The state of the pandemic days before China's Spring Festival holiday and the Beijing Winter Olympics.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. The world grapples with the highly infectious Omicron variant. The world saw 3.6 million new cases on Monday alone. 1 million of those cases were detected in the U.S. China is not immune from the Omicron variant, despite its strict zero-COVID strategy. The Chinese mainland has seen cases detected each day for the past week, with Winter Games just 8 days away. These new cases in China come amid the Spring Festival travel rush. How can China and the rest of the world control the surge of the more infectious Omicron variant? And what are the latest ways of dealing with COVID-19 as a whole? Let's ask our panel of experts. For more on the latest of COVID-19 pandemic in Seoul, we have Dr. Alice Kim Kyung-tan, internist at Ms. Medi Women's Hospital. In Providence, in the U.S., Dr. Megan Rani, who is the emergency physician with Brown University. In New York, Vincent Raccaniello, microbiology professor at Columbia University. In Washington, D.C., Yang Hongjun, co-director with the Precision Medicine Professional Committee, the Chinese Society of Biotechnology. Ladies and gentlemen, welcome to the program. I urgently need advice from all of you. Dr. Rani, can you brief us about your understanding of the latest situation?
So Omicron is a new variant of COVID that has multiple new mutations. The effect of these mutations is twofold. This variant seems to be significantly more transmissible than prior variants of COVID, to the extent that it is pretty much displaced here in the United States, the Delta variant that was previously so dominant. At the same time, Omicron seems to be causing milder illness in many of the people who it infects, meaning that on average, if someone gets infected with this new variant, they're less likely to get severely ill, hospitalized, or God forbid, die than people who got infected with Delta. Unfortunately, because those two factors, it's both more transmissible and seems to be slightly more mild, it kind of equalizes out. So on average, across the United States, across the United Kingdom, and across other countries that have already experienced an Omicron surge, the net effect on hospitals and on healthcare systems ends up being about the same. So although for an individual person, Omicron may be a bit milder, on a population level, it ends up having about the same effect as those earlier, more dangerous variants of COVID.
And now we're experiencing the second stage, at least in the US, in many places, of the variant of Omicron already.
That's right. You know, here, certainly in the Northeast and in some other states across the United States, we saw the Omicron cases quickly peak. So we saw a very dramatic rise in cases. A week or two later, we saw a rise in hospitalizations. We're now seeing rises in deaths. And at the same time, cases are already starting to drop in some parts of the United States. Of course, because the US is a huge country, we're still seeing the Omicron surge spread. And particularly in states with lower numbers of vaccinated people, we're suspecting that the impact on hospitals and on mortality, on death rates, is going to be tremendous.
People have been asking Mr. Raccaniello about whether it is the first stage or second stage of Omicron, the new stages of the variant Omicron, and nobody knows at this moment what might be the impact on the mass population.
As long as so many people are infected, we will have new variants all the time. There is one solution to the problem of variants, and that is vaccination. Vaccination will result in milder disease with any of the variants. And in fact, one of the reasons why Omicron is mild is because so many people are vaccinated. They don't go to the hospital, they don't get severely ill, they don't die. So if 90% of the US were vaccinated, we only have 63% vaccinating, which is really a shame. If 90% of the US were vaccinated, we wouldn't even been talking about this right now.
Experts like you would always argue so, and yet there's also many others talking about no matter what kind of vaccination that you have will not necessarily deal with the Omicron variant. And we understand some of the pharmaceutical companies only now begin to try to research about the vaccinations that could deal with Omicron. So whether vaccination is that effective to what you have just said, is this still a question mark?
It is not a question mark. Vaccination was never meant to stop infection. It was meant to stop severe disease, and it's still doing that. Omicron, yes, it will infect vaccinated people, but they would either not realize it or they have a mild disease. The one, mainly the people who are getting very ill are the unvaccinated, and they are driving these outbreaks. There's no question about that.
There was talk earlier, Dr. Rani, about the United States, for example. We're going to see the peak of the Omicron, and also that's likely to happen at the end of February, moving on to March. Is that timetable still relevant, or it's very different today?
I think that is still quite accurate for the country as a whole, but with the recognition that it's going to peak at different times in different parts of the country. So New York City, Rhode Island, where I am, Massachusetts, Connecticut, we've likely already seen our peak in the number of cases. Hospitalizations, deaths are a different matter. We're seeing rising cases, however, in other parts of the country. Mississippi, Alabama, Utah, North and South Dakota have seen dramatic increases in cases in the prior days. I'm suspecting that by the time that we get to the end of February or early March, we'll have seen the Omicron surge pretty much pass through our country. But of course, as long as there are so many of us unvaccinated, we never know what's going to happen with another variant. So I'm quite thankful that this surge seems to be peaking and then resolving relatively quickly compared to prior variants. But to me, this isn't a moment necessarily to celebrate or to declare mission accomplished, but rather a moment to double down on making sure that we have precautions in place to stave off future surges.
Dr. Recanello, there were earlier signs of celebrations among some people, suggesting, well, it seems that COVID-19 is ever becoming more resemblance of a flu, and therefore probably that is the trend we're likely to see. At this point, can we make that judgment?
Well, of course, we don't know the future. Very hard to predict, especially the future. But what we do know, and this is quite clear, if you are vaccinated, especially 3 times vaccinated, you will not develop, you are not likely to develop severe disease. You are not likely to go to the hospital. You're not likely to die. And that's been the case with every variant so far. Now, what has driven this surge is the unvaccinated people, people going home for the holidays, and people getting back to life more so than any other time in the pandemic. They're mixing, and that has driven this.
Are you talking about another vaccination, the 4th shots? Because 3 shots is already quite something for many people. Can we just keep on having shots?
No. I think we don't need more than 3. This will be a 3-shot series. That's what will be in the end. 4, 5, 6 is absurd. It's not a good public health measure, and it's not needed. All the immunology results tell us that 3 doses give you really good immunity to all of the variants. That's all we need.
Are you talking about vaccines of Pfizer, or are you talking about vaccines generally speaking, 3 shots?
Well, I'm most familiar with the ones we have here in the U.S., the Pfizer, the Moderna, 3 doses, the Johnson & Johnson, 2 doses. Other vaccines made elsewhere obviously have their own booster schedules.
Dr. Alice Kim-Kyung-Tan, you and I have been talking about this very long time. How do you see the danger of Omicron vis-a-vis the Delta variant for South Korea. How do you see some of the questions that the other two guests from North America touched on?
Right. So Omicron just claimed dominance in our country as of 2 days ago. And we're certainly seeing it in terms of our numbers. This morning, we reported more than 13,000 new COVID cases, which is a record-breaking number for our country. The big question is, what has been discussed. Will our vaccination campaign, will this be enough to protect us from Omicron? Protection meaning, of course, protection against severe disease and death. Of course, we've already seen some breakthrough cases after a third dose, so after a booster shot. They have not been severe, fortunately, but few in number. But we are seeing an increase in hospital admissions. We logged more than 800, which is our second highest number to date in terms of new hospital admissions. We've managed to administer booster shots to more than 80% of our seniors, age 60 and above. But in terms of a population level, it's just about 50% of our population has received a third dose. And our scientists in the laboratories, when they checked the neutralizing antibody levels after certain regimens that did not have 3 doses of an mRNA vaccine. In other words, it was AstraZeneca for dose 1, AstraZeneca dose 2, and then Pfizer, or AstraZeneca, then Pfizer. When we looked at the geometric mean titers of neutralizing antibodies, they were significantly lower compared to people who received 3 doses of Pfizer. So that's my concern right now, is we have a large number of people who started off with the AstraZeneca vaccine. And it looks like even though they received their booster, which was an mRNA vaccine, the Pfizer, their level of protection seems to be much lower than other members of the population. So as you mentioned, Lunar New Year is a few days from now. It's a big holiday. There's going to be a lot of mixing, a lot of gathering. What I've been telling my listeners, my friends, my family is, if you are going to travel and gather with family, make sure that you are VBT, vaccinated, boosted, and if there's anyone older than 60 in your party, tested. Go to the pharmacy, get a rapid antigen test, and make sure that everyone tests negative before you gather. If we can take measures to make the gathering process safer, I think in some cases it's really more of a humanitarian issue in terms of having families gather over the Lunar New Year.
It is beautifully put, Dr. Alice Kim Kyung-tan, that it has become such an issue beyond the medical terms. But I do want to ask you about the test, since all of you mentioned about the test, yet some of the variants, for example, with Omicron second stage, it might be, some suggested, very hard to detect. How are we going to deal with that? In other words, if we're not tested, we're not be able to know, who has the problem and how to quarantine.
So what's becoming clear in South Korea, as we look around the world and what's happened with Omicron, is that test positivity numbers, already have started to go up in South Korea. We know in South Africa, test positivity went up beyond 20%. And so we may not be able to test everyone who in previous waves would have qualified for a test. And so right now our strategy has shifted to prioritize testing for people who are at highest risk. But my concern, which is what you are mentioning, is unfortunately with Omicron COVID, of course, people are most infectious early on after inoculation. And that's when they maybe have mild symptoms, maybe no symptoms at all. And so we may be missing many people by doing rapid antigen testing and letting them know, oh, your first test is negative. giving them sort of a false sense of assurance when in fact, it was a false negative. We've seen that in many cases. And so I think we do need to educate the public, letting them know what does one rapid antigen test result mean, especially if it's negative in the case of Omicron, and what kind of precautions they should take. Definitely, I think 2 tests are what's needed, at least, to be able to detect Omicron.
I see.
And so if we have a lot of false negatives and people are not careful, that can lead to another explosion sort of on top of our baseline community spread of cases. And that's my biggest concern.
China now, if you look at the latest number, are mainly cases related to Delta rather than Omicron. So that is a very different story compared mainly to the rest of the world, even to our neighbor like South Korea or Singapore. So how do you see that as a professional in the area? What does that mean?
I think Delta is very dangerous variant of COVID-19. So, as Professor Ronnie mentioned that the Omicron is spread out very quickly, but the disease, the symptom is mild, but Delta is very strong. So that is very, we do need some special measure to control the Delta spread. And I think to me, as the professor mentioned, one is vaccination, 2 is self-protection, 3 is education to the population.
What about vaccination, Professor? In China, we see that vaccination rate already reached quite a level, even to the senior population in China and the kids as well. So, of course, different countries have different vaccinations, different vaccines. China mainly uses produced their own research vaccines. What about the effectiveness of these vaccines? People mainly already have 3 vaccinations. In my neighborhood, for example, in the elevator, you could see the little notice suggesting you can go there to do a 3rd shot. So how has been the vaccine working so far?
I think, to my knowledge, even different country has a different type of vaccine. But to my knowledge, I saw that today's report say China, the Sinovac, still making very significant protection for the people. So I think that I encourage the people in China is still need to take the vaccine, even this is produced in China. That still works. Don't have too much suspicious is that working compared with it's not necessary. The first priority is protect your life. So whatever the vaccine you can access, I encourage the people, go ahead to have the vaccine anyway.
And this is World Insight. Stay with us. We're continuing our discussion on the global pandemic right after the break. Welcome back. This is World Insight with me, Tian Wei. Let's continue our conversation on how to control the Omicron variant and what is going on in different parts of the world with our panelists. Now the Olympics is going on very soon, and we see China has established, together with the International Olympic Committee, what they call a closed loop. Mainly those who are traveling from overseas can come into this closed loop, but they don't interact with the rest of the population in China. And yet they will also be tested when they come in, and they will be tested regularly, everyone. If they are being tested positive, they will have the quarantine. Those who did not have the vaccine, some of the athletes prefer not to because sometimes it could affect their performances in the competition. They will have to come in 14 days ahead to quarantine so that they will be tested safe and be able to compete with the rest of the athletes once the Olympics starts. But this is a very specific approach. How is that approach with a bigger context of what we are going through right now? Dr. Kim Kyung-Tan, maybe you go first.
Yes, I actually worked at the Pyeongchang Olympics for 2 months in the International Broadcast Center. And at that time, of course, there was no COVID, but there was a big influenza outbreak in the United States. And when all of the crew from the US came into South Korea, they brought many cases of the flu with them. And it was quite an effort to try to contain influenza within the IBC and then also within all of the venues that the crew, of course, they were everywhere. If we look at what happened in Japan during the Tokyo Olympics during the summer, I think we can see the risk of what you were saying, the Delta variant during the Olympics. And it's not just the Olympic venues themselves. You know, you have the mountain cluster and then you have the ice skating rinks. It's what goes on in the public, because the Olympics are a celebration. People want to watch the Olympics, not by themselves, but with their friends and their family. They want to cheer on their national athletes. And in Japan, it's very clear that a lot of mixing and gathering happened during the Olympics, and it caused a huge surge in Delta cases. And of course, that led to hospitalizations and deaths. And so I think the closed loop system is great for containing the virus, COVID, within the Olympic venues. But of course, you do need to be careful with what's going to go on in the rest of the country, because of the celebratory nature of the Olympic Games, and making sure that the Olympics do not become a super spreader event.
Right. And Dr. Raccaniello?
The best we can do, and I agree that Olympics should go on because we have vaccines that work. They keep you from getting seriously ill. Everyone should be vaccinated. The idea that it affects your Olympic performance is simply a timing issue. You get vaccinated months ahead of time, and it's not an issue.
Yeah. And Dr. Rani?
So agree with what the prior two professors have said. I will add on that the additional part here around the Olympics is re-emphasizing the importance of a multi-layered prevention strategy. So vaccines and boosters are critical, and those are the bedrock of preventing spread of COVID infections. On top of that, you layer masking, you layer multiple times of testing, you layer on ventilation, and then you do layer on this closed loop system to try to contain any cases that do come into the country. It's highly unlikely that as a result of the Olympics, that infections will spread outside of Olympic Village to the larger country. However, there are two remaining concerns. One is there are obviously staff who are interacting with the folks, with the athletes living at the Olympic Village. People are providing food services, housekeeping services, and so on. And so I hope that those folks have access to adequate masks and testing in order to prevent spread from the Olympic villages out into the community. The other part of it that I worry about is about people spreading new variants to each other or bringing new variants home to their host countries, particularly for those who are still unvaccinated. That was a big worry with the Tokyo Olympics. Thank goodness that did not serve as a nidus of new variants, but given that not all of the athletes are vaccinated, unfortunately, this mixing from different countries serves as a perfect petri dish for the potential emergence of new variants to spread. I hope that won't come to pass. That's a worst case scenario, but that is the other part of the Olympics that does concern me.
That's why, as you said, they need a multi-layer prevention at this moment. And I think by reading the booklet coming from the International Olympic Committee for this specific 2022 Winter Olympics, it seemed that multi-layer system is being established. We'll see how things will. Certainly, our prayers are with all of them. Last but not least, Professor Yang, since you are closest to China in a way, tell me more about your final thoughts on the Beijing Winter Olympics.
I think we, with such a multi-layer protection, and I hope that Beijing Winter Olympic will be a very successful celebration. And I think we all watch through the TV, and I expect we have the biggest celebration at home.
At home only.
Also, as well as the year of tiger.
All the best, certainly on that note, to all of you for the year of the tiger, healthy and happy. Hopefully it is going to be a year of that. Thank you so much and really appreciate that. Thank you. And that's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of my team. Thanks for being with us.